Well, I felt like I was really losing it. I had been, at the point that I sought medical help, I had been 5 weeks with interrupted sleep, to the point where I felt I was really experiencing sleep deprivation symptoms. I had hot flushes, palpitations, sort of a free-floating anxiety, and I would be awakened in the night because of overheating, and it had gotten to the point where my capacity to have any degree of concentration was shot. I would hear people say things to me, and the words would come in and I could not comprehend. I was just because I was so tired. And so I sought attention from my regular medical physician. And basically what happened to me when I called, I was informed that I was too young. What I had asked for was a serum blood level test to determine if I was beginning menopause or whatever, and I could not believe that I was told. My whole reality was discounted right in front of me, and to be told that I was too young, therefore this was not happening. I was like, well, tell my body that. And
now, do you mind using your age?
No, I'm 41, which in fact is relatively early to be having full-blown symptoms. Nevertheless, I was. And I felt totally discounted by my physician. And what he wanted to do was to have me take a hormone that would kick in my period. And then if it didn't, then I would take more of it. And then if that didn't happen, then he was going to send me for this blood test. And I was starting graduate school in 3 months. And I couldn't sleep. I couldn't communicate. I had to do reality checks all the time. Is it hot in here? I couldn't function very well at all. I was a lunatic a lot of the times. I guess I personally, for most of my life, had thought in terms of, being the good little girl, and traditionally have had male doctors, and you do what they tell you. And I had some real concerns. I've heard and read about the degree of care that needs to be taken in consideration in use of hormone replacement therapy. And it was not something that I was willing to just jump right into. And so I had been raised in a family. In fact, I'm the only person in my family not in medicine. And I was raised in a family of very traditional thinking about medicine, and the doctor is God. And you just sit back, they tell you what to do, and you do it. And that's what I've done, really, for most of my medical care. I had no ownership or partnership in my medical care in the past. And I think it was just to have my reality discounted that ticked me off. And I said, no, I am not willing to just sit back and do what he says without, thinking about it at least. Excuse me. I felt that my gynecologist was denying my physical reality, in essence, when he said, you're too young. And that's what I meant. That he just, it was like, well, you're only 41. It doesn't fit what I know. And so, wait. The reality of my situation was that I was having hot flashes, palpitations, anxiety, sleeplessness, the works. Typical, classical menopausal symptoms. And my gynecologist was essentially saying, no, you're not, because you're too young. So it can't be. You don't fit. And I wanted to say, tell my body that. It doesn't get it,
Good.
I can't honestly say that I might not, in fact, have just gone along with the flow of what he said and been the good little girl and popped those, hormone pills. However, a coworker had happened to hear Dr. Northrup being interviewed on the public radio, and serendipitously for me, the topic was treatment of menopause, alternative treatments for menopause. And she came in and the next day, and I told her about my experience with my physician and how angry I was. And she said, "You're not going to believe this, but guess what I heard on the radio?" And she proceeded to tell me about the kinds of alternatives that were available that she heard Dr. Northrup talking about, that it didn't just have to be, one and only choice of hormone replacement for treatment of symptoms of menopause. And so I called Dr. Northrup's office and was able to get an appointment the next day. Someone had canceled. And what I really liked was that I felt heard, I felt listened to, I felt that I was treated with dignity. And what she said was, "You don't have time to mess around. You're starting school in 3 months. You have to be at your optimum level of performance, and we're going to get this taken care of right away." She did a brief physical exam, and she wrote out a prescription for the blood level test, which I had the next day, which confirmed that I was smack dab in the middle of menopause. I sort of went, not that I was real thrilled, but I felt validated that, in fact, yes, this was going on. First of all, she was a female physician, certainly, which I think helps. Also, she had known my father, who was chief of surgery, and she had an understanding of the nature of his personality and the upbringing that I'd had, and the disdain that was held in my kind of family for non-traditional medicine. She understood that because she was trained traditionally and then broadened out on her own, as far as I understand. And so she had an idea of where I was coming from in terms of, this was really a leap of faith for me to try this, given my upbringing and the judgmental attitude that my family had had, my medical family, towards non-traditional medicine. And she heard that my body was doing all of these things, and she listened. If I had to face graduate school in the place that I was in back in the spring, I don't think that I would last a semester. I really don't believe I could. I don't know that I could have lasted a month with that kind of thing going on. It's been 20 years since I was in school anyway, and I had a lot of anxiety approaching the whole idea of returning to school after 20 years. The thought of having all of those physical things going on with me, and most particularly the lack of ability to concentrate, I would not be able to do it. I know I would have had to bail out probably very quickly along the line. Dr. Northrup had made several recommendations to address my symptoms, and one of which was to try a homeopathic pellet, taking it on a daily basis, made of bark and herbs and things like that. And I have to tell you that I called them my nature pills, and that in a sense I'm not sure that I gave them much credence to be able to do anything at all. And it was absolutely incredible. Within 5 days, I was totally asymptomatic. I had no hot flashes, no palpitations, no anxiety. And I would say probably within 2 weeks, I felt normal again. I was present, I had energy, I could concentrate. It was miraculous, it really was. And so because of that, I've been on that for a number of months now. And I have the energy to do what I need to do. And I have the mindset, because I am not distracted by my body, that I'm ready to go, really ready to go. all of the medicines that we have today originated in homeopathic, natural kinds of things, and then they extracted what they thought were the important ingredients and synthesized them and such. But that it's not controlled, say, for example, by the FDA or whatever, and so physicians prescribing alternative medications and alternative treatments really have to have a complete understanding about what it is that they're putting out there. And I hadn't thought about that, and the particular thing I was taking, it was for my metabolism, and I felt like I had had 7 cups of Turkish coffee, and I was ready to go to the emergency room. And I'd called my brother, and that's when he was sort of reaming me out about this, But specific to my menopausal symptoms, the treatment for that, I think that the best argument that I have is for the experience that I had and the response that my body had to that treatment, and to the sense of well-being that I have now. That I like the idea that it's organic, that it's natural, and I have a greater appreciation. I don't call them my nature pills anymore because they are very powerful treatment, very powerful medicine, and has to be treated accorded that respect. But I really feel that what I would say to them is, I am totally relieved of my menopausal symptoms without having to resort to hormonal replacement therapy. And that's a big deal. I'm not saying that somewhere down along the line I might not have to have some as my hormones reduce greater, to lower and lower levels, but even then, Dr. Northrup has some more tricks up her sleeve in terms of there's a lotion that you can put on your skin made of papayas or something that they've extracted hormones from, and it goes in through your skin, so it's almost like those patches they have probably, but it's very natural. And I guess I just feel like I'm not ashamed at all of talking about being in menopause at 41. I consider it a part of the natural process, and I'm trying to do it with dignity and grace. And I feel that this, being a partner in this alternative treatment, has really allowed me to experience that. And I feel like it is a phase in my life, and the treatment will move through phases as well. And perhaps there might come a day when I need to take, synthetic estrogen or whatever. But I like the idea that I am able to address that need in an alternative way right now. I would say to women who are working with traditional medical practitioners who perhaps are just starting the process of exploring treatment for menopause, or perhaps are not there yet, but know it's going to be out there for them at some point along the line, I would say be willing to keep your mind open to learn about what alternatives are available in terms of treatment, and in terms of physicians who think alternatively as well. And also, I have an identical twin sister who's very interested because she has not begun having symptoms yet. Her husband is a radiologist, very traditional medicine man, total medical family there too, and I'm sure the push is going to be for her for very traditional treatment. And yet, I expect I'll be getting a call from her with the first hot flash she gets. Tell me about those little nature pills you talked about, because it's an inevitability that will come for all women, and it's just the degree of the symptoms.